My name is Tania Huddart. I've been teaching movement for over 30 years. And today I would just like to share with you some of the things that I've found really help with improving your breathing. So they're more body movements than they are breathing exercises. So it's really important to be able to do good diaphragmatic based breathing. But sometimes when we've got a lot of tension up through the neck and shoulder area and even in the face, it can be really hard for us to access that deep diaphragmatic breath that we're always looking for. So here are just a few simple exercises that you can do at any time throughout the day. These are particularly effective when you've been sitting at your desk for a long period of time. Maybe getting up and going for a walk and doing some of these exercises will just really help you to improve your breathing capability, but also to relax any tension that you might have from sitting for long periods of time. So the first series of exercises we're going to do will target the neck and shoulders and also encourage a little bit of movement through the rib cage. So the first movement that we're going to be doing is something you're probably all familiar with, which is a shoulder shrug. So you're going to inhale and you're just going to shrug the shoulders up, and you're going to exhale. You're going to let the shoulders just melt down. So I don't want you to jam your shoulders down. I also don't want you to work too hard here. Just invite the movement in, let the shoulders sort of glide up, and then just imagine your shoulders melting down and just let them rest on top of your rib cage. And again, just take a gentle inhale through your nose and a gentle exhale through your nose as well. So we're just going to breathe in and out through the nose as we explore raising and lowering the shoulders. So no tension here, just inviting the movement, just being very gentle and just enjoying that sort of sense of contraction of the muscles and then release. Beautiful. Now we're going to just do a little bit of side bending. So for this side, I'd really like you to think of one side getting longer, the other side getting a little bit shorter. So you're just going to lengthen up as you inhale, and as you exhale, just bring yourself back. Same thing, breathing in and out through your nose. Inhale over, exhale to come back. Inhale over, exhale to come back. So if an image helps you here, you could potentially imagine that you're yawning, your ribs nice and wide on one side, and then just let them relax back. And then just yawn the ribs open on the other side and slowly come back. Breathing in as you yawn your ribs open on one side, relax as you come back. And one more time, breathing in and relax as you come back. Good. We're going to do a little bit of rotation now. I'm going to get you to press your hands together into a prayer position and just press your thumbs onto your breastbone. So that will help to open up the space between your shoulder blades and stop you from sort of squeezing the shoulder blades together when you do this exercise. And now you're just going to twist your ribs gently from side to side. So that just helps to stretch out any tightness between your shoulder blades as we do this little rotation. And if you are in a public place and you feel a little bit self-conscious about doing this particular movement, just relax your arms and just do the same thing. So it's just a very gentle movement, and just breathe through the movement. There's no particular breath that you have to do here. Just keep breathing, inviting the breath in and inviting the breath to leave your body. So just a gentle release, because this is the movement that your thoracic spine makes when you're walking. So it's a really nourishing movement for your spine, but it also gives your diaphragm a little bit of a massage as you're moving from side to side. Good. So let's just recap those three movements. The first one is just the shoulder shrug, up and down. The second one is lengthening through one side, come back to the middle, lengthening through the other side, and we talked about yawning. And then our third one is the rotation. So this helps to open up tight spaces between your shoulder blades, and we're just going to gently move the ribs from side to side, making sure that it's not your hips that are doing the work here. And if that feels uncomfortable or you don't like having your hands in that position, then just keep the arms down and just allow your ribs to gently twist from side to side. Beautiful. Now we're going to move into the face. So there's a very particular muscle that works your jaw, that connects your upper jaw to your lower jaw, and we use that a lot for chewing and for talking. Now this muscle is incredibly powerful. It's called your masseter muscle. And when that guy is tight, what it'll do is it'll actually start impacting on your secondary breathing muscles in your neck. And then that will in turn sort of inhibit your diaphragm from doing what it should be doing. So I've just got a very simple release that you can do. It's a massage. You're going to use your middle 3 fingers and you're just going to come along the bottom of your top jaw here. So you can open and close your mouth and just feel where the joint is. So that's your TMJ joint, and just come in front of it and then just let the other fingers rest on your face as well. So it's really important here that you only move in one direction and that you take a little bit of time to first push your fingers in, like pushing into a block of clay. And now imagine you just dragging your fingers down in that block of clay and making a groove with each finger. And then you're going to come back and do that again. So we're going to aim to do about 10 of these. So you'd be amazed how much tension you would actually be holding in your jaw. And this is a great way, especially if you've got any TMJ problems as well, this will help to relieve some of the tension in there. Or if you grind your teeth at night, you might find that you've got a lot of tension in here as well. The face is incredibly powerful, all of these muscles that we have here to create our expressions. And when they get a bit tangled up, they do inhibit our breathing. Good, so probably another couple to go. And then just relax for a second. And you might just want to take a moment to just see how that feels. Now we're going to come onto the other side. So just finding that connection there. And just gently dragging your fingers down as if you're dragging in a block of clay. Imagine you making those grooves. So just a nice firm pressure, not so much that you hurt yourself, but you want to be able to feel that release happening. Especially if you suffer from neck tension as well, this would be a great way for you to help ease some of that neck tension. Good. All right, now quite often we also get a lot of that neck tension which will inhibit our secondary breathing muscles here in our neck from working well. So we're just going to look a little bit at head placement. So we want to think about the chin as if it's sitting on the very front of the shelf, and all we're going to do is we're going to shift it onto the back of the shelf. Now you might want to put one hand just over the lower part of your rib cage, because quite often we think we're moving the head, but what we're actually doing is leaning back from the lower back and pushing the ribs forward. So I just want you to keep your ribs relaxed and just think of taking your chin and just pushing it back gently. So it's a very gentle movement. Don't put too much force into it. If you can't quite connect with this, the other thing you can do is think of pushing your tongue right up into the roof of your mouth. And feel how that realigns your neck as well. Again, without the force, so that you start changing other areas of your spine as well. So let's just try that again, just gently pulling back and release. And pulling back or pushing your tongue up into the roof of your mouth. And release. And one more time. Beautiful. So just do as many of these as feels comfortable and don't overdo it. So what we're actually doing is trying to strengthen some of the muscles in the front here and lengthen some of the tightness in the back of the neck. So especially if you get sort of tension headaches and things back here, this is something that will help to just gently stretch and release. We don't want to be too much, put too much force into the neck, because that would not be comfortable. So I mentioned the secondary breathing muscles. We're going to now just find them. So if you think about this big muscle here at the side of your neck, so if you turn your head, it comes up quite prominently. The muscles we're actually interested in sit just behind that muscle. So if you just want to gently, very gently in your neck, just bring your fingers just behind that muscle on each side. There are 3 pairs of muscles, one pair on, or one set on each side of your neck. They're called your scalenes, and they help to keep the top of the rib cage open when you inhale. So you're not actually going to be affecting these muscles here at all, but I want you to just be aware of how they work. So you're just going to visualize those muscles. So as you inhale, you're going to feel your fingers just gently lifting up slightly towards your ears, so you're barely touching the skin here. And then as you exhale, just let your fingers relax back down. So as you inhale, those muscles are just lifting up the top 2 or 3 ribs to keep the airway open. And then as you exhale, they just relax down. So if we didn't have these amazing secondary breathing muscles in here, then we wouldn't be able to get any air down into the diaphragm because the whole rib cage would collapse. Okay, so we're just going to inhale, just feel them gently lifting and then gently releasing. It's unlikely you'll actually feel this, but if you can visualize it, just know that it's happening. It really helps us to clarify how we're working. And then if we've got that sort of sensation in there, then we can start really bringing the focus down into that diaphragmatic breath. So just inhaling as we lift gently and exhale as we relax. Good, that's beautiful. That's a really good start. Thank you for joining me so far. Bye.